Welcome to meeting number 35 of the House of Commons Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. Today's meeting is taking place in a hybrid format pursuant to the House Order of January 25th, 2021. The proceedings will be made available via the House of Commons website. The webcast will always show the person speaking rather than the entirety of the committee. If at any time during the meeting you have any technical difficulties, let me know. We'll want to resolve them and if necessary, suspend to make sure that everyone is able to fully participate. Pursuant to Standing Order 108 sub 2 and the motion adopted by the committee on Tuesday, the 2nd of February, 2021, the committee will proceed with its study of the impact of COVID-19 on seniors. I'd like to welcome our witnesses to begin our discussion with 5 minutes of opening remarks, followed by questions. We're pleased to have with us today the Honourable Deb Schulte, Minister of Seniors, and from the Department of Employment and Social Development, Alexis Conrad, Senior Assistant Deputy Minister, Income Security and Social Development Branch and Policy Horizons Canada, Annette Gibbons, we hope, Associate Deputy Minister, and Janet Goulding, Associate Assistant Deputy Minister, Income Security and Social Development Branch. For the benefit of our witnesses, just a few additional comments. Interpretation in this video conference is available. You have the choice at the bottom of your screen of either Floor, English, or French. When speaking, please speak slowly and clearly. When you're not speaking, your mic should be on mute. And with that, I think we're ready to go. We're going to start with the Minister of Seniors for 5 minutes, please. Madam Minister, welcome to the committee. You have the floor.
Thank you very much, Mr. Chair. Bonjour à tous. It's a pleasure to be back with you all today. I'm sincerely pleased to see the committee's interest in seniors' well-being. And as Canada's Minister of Seniors, I spend every day thinking about seniors' needs and how we can better support seniors in their day-to-day lives. Our government is committed to strengthening Canadian seniors' financial security and improving their quality of life. La sécurité.
The financial security of our seniors is our priority.
First actions for seniors as a government include restoring the age of eligibility for old age security to 65 from 67, increasing the guaranteed income supplement for single seniors, and doubling the Canada Pension Plan for future retirees. Budget 2021 strengthened all Canadians' financial security later in life. Older seniors are worried about outliving their life savings. As seniors age, their health-related costs rise. All the while, they are more likely to be unable to work, have disabilities, or be widowed. To provide short-term support, we will provide a one-time payment of $500 in August to OAS pensioners who will be 75 and over as of June 30th, 2022. And then in July of 2022, we'll permanently increase the regular old age security pension payments by 10% for seniors aged 75 and up. This will provide $766 to full pensioners in the first full OAS pensioners in the first year and be indexed to inflation going forward. The OAS increase will strengthen the retirement income security of Canadians later in life. And it's the first permanent increase to the OAS pension since 1973, other than adjustments due to inflation. This builds on our direct financial support to seniors during the pandemic. We provided an extra GST credit and a one-time payment to seniors eligible for OAS, plus extra support for those that were eligible for guaranteed income supplement. Altogether, a low-income couple received over $1,500 in tax-free support with their extra costs during the pandemic. Canada's vaccine program is accelerating. We're on track to receive 40 million doses by the end of June. Our government will always be there as a partner with provinces and territories to help keep people safe. Working together is what will get us through this crisis. More than 8 of every $10 spent to fight COVID-19 and support Canadians continues to come from the federal government. We've procured over 1 billion pieces of personal protective equipment and tens of millions of rapid tests, which we've been distributing to the provinces and territories. And we've funded over 5,000 New Horizon for Seniors community projects across the country to support seniors during the pandemic. To better protect seniors in long-term care homes, we'll provide $3 billion to the provinces and territories to ensure standards for long-term care are applied and permanent changes are made. And we've invested billions in infection prevention and wages of long-term care workers and others. We will establish new offenses and penalties in the criminal code related to elder abuse and neglect. Across the country, most seniors want to live in their own homes for as long as possible. To help seniors stay in their homes longer as they age, we're launching Age Well at Home, a new initiative that will offer practical support to help low-income and otherwise vulnerable seniors age in their homes. Budget 2021 will also announce additional funds to repair, build, and support affordable housing, make improvements to the criteria of the disability tax credit, provide an additional 4 weeks of for the Canada Recovery Caregiver Benefit, and new funding for veterans and palliative care. Seniors built the Canada we know and love today. They can be assured that our government will continue to deliver for them. Merci encore de l'invitation.
Thank you once again for your invitation to me today.
To your questions and seeing your findings and recommendations. Thank you.
Thank you, Minister. And now we're going to proceed with those questions, beginning with Ms. Falk, please, for 6 minutes.
Thank you, Chair. And Minister, thank you for being here with us today for this important and also timely study. We do know, and you alluded to this, that seniors have been particularly hit hard by the pandemic, and those seniors living in long-term care facilities have been at the epicenter of this health crisis. Layered with a sector that's already in crisis, the scarcity of PPE, delays in testing, staffing shortages, and inadequate infrastructure all contributed to this tragedy in long-term care. The failure to protect Canada's seniors in long-term care shamefully stands out on the world stage. And too many of our seniors died of neglect. Too many families have had to say goodbye early. Too many seniors have missed out on countless precious moments. And there have been announcements. But Minister, we need to move beyond that in a timely manner. We need leadership and collaboration with all levels of government and senior stakeholders to really move the needle. We need to stabilize the sector, but also take meaningful action to address the serious vulnerabilities in the sector. And we owe that to our seniors who deserve to live and age with dignity. The reality is, from health to social isolation to finances, no senior has been fully immune to the challenges that has been brought on by this crisis. For low-income seniors over the age of 75, the one-time OAS payment and subsequent increase announced in the recent budget is helpful. But I have heard from a number of seniors from across this country, and I suspect that my colleagues have also been hearing from seniors under the age of 75 who are struggling to make ends meet and feel left aside by your government's decision. Minister, why did you exclude some low-income seniors from your one-time OAS payment and scheduled increase?
Thank you very much for that very complete question. There was quite a lot of elements that you brought into that discussion. But to answer specifically why we delivered on our promise to increase old age security for those 75 and above, you need to look at the data that we were looking at and the information that's guiding decision making. So let's go for a bit of information here. For those seniors below 74 or below 75, about 34.2% are employed. Seniors 75 and above, it drops to 15.4%. The median income of those that are below 75 is $10,000. The median income for those 75 and above is $720. For disabilities, seniors below 75, 32%. 75 and above, 47%. Severely disabled, 27%, 75 and above, 15% below. Women, 57%, 75 and above. Widowed, 39% are widowed, 75 and above, to 23% below. I can go on and on with the data and the statistics that show us that our older seniors are more vulnerable and in more need of support. If you look at the information back when The last increase was made to old age security in 1973. And you look at the age that people were expected to live and where it is now, it is 7 years on. So we are seeing seniors living much longer, having more complications as they get older, facing more costs, and being really afraid of running out of their savings.
Minister, at one of our previous meetings, we had Dr. Sinha with the National Institute on Aging, and he questioned your government's use of OAS instead of GIS as a tool to support those low-income seniors. So I'm just wondering why your government did not increase GIS instead.
Well, thank you for that question, because what you have to do is you have to look back at what our government has been doing over the last 5 years. And this is just one more step in the measures that we've been taking.
But I think COVID is kind of changing things. And that's what this study, I think, is going to reveal is COVID's exacerbating these issues. So I don't think that we can necessarily look at what's happened pre-COVID, and we really need to see the effects that COVID is having on our seniors.
I'm very much looking forward to the outcomes of your study and the recommendations that you're going to make. But I think it is important, while there are some things that COVID pandemic has highlighted and shone a spotlight on, you need to look at what we've been doing to build the financial security for seniors all along. First thing we did was to increase the guaranteed income supplement for single seniors, because we saw those as our most vulnerable seniors that needed support. So that's why one of the first things we did was to increase that. And then
thank you, Minister. I'd like to get one more question in here if I can. We've seen a major decline in retirement income following the passing of a spouse, and this can certainly add significant financial stress and even uproot a senior's entire retirement plans. Your government promised to increase the CPP survivors benefit in 2019 and then recommitted it to it in the throne speech. So, Minister, I'm just wondering, when can widows and widowers expect that increase?
Thank you very much. Another really good question. So what you need to recognize, as was the case with the enhancements to CPP that we did several years ago, that it is the contributions. What you need to do is you need to increase the contributions if you're going to change the outcomes for.
So is this a promise that's going to be kept throughout the tenure of this government?
So let's just go back to what I was trying to set the frame. So the frame is that it's for future retirees, and that is set with the discussions of the ministers at the provinces and territories. It's not something that the Canadian government can do on its own. It needs to do anything with CPP is done in conjunction with the provinces and territories.
So what's the progress on that?
So what happened was the review that occurred, the triennial review that occurred, was in the pandemic, and so obviously the outcomes at that meeting was it was a difficult time to be increasing the employer contributions and the worker contributions when we were dealing in the middle of pandemic. So there is future discussions to be had, but right now that isn't something that is happening. But at that triennial review, but there will be future reviews, and we'll continue to work. This is an important initiative and commitment that we've made, and we're going to be continuing to pursue that in our next triennial review.
Thank you so much, Minister.
Thank you, Ms. Falk. And next, Ms. Young, please, for 6 minutes.
Thank you very much, Mr. Chair, and thank you to the Minister for spending time with us this afternoon to talk about our important study. I wanted to read something to the Minister from a recent pamphlet that the United Way of Elgin and Middlesex distributed in my area. The pamphlet is actually called The Love Letter, and it outlines some of the amazing programs the United Way and other agencies have been able to provide our seniors during this obviously challenging time. Specifically, I'd like to read about a program funding through your department's New Horizons for Seniors program. It says, at the start of the pandemic, Canadian Mental Health Association Middlesex saw a 43% increase in calls to the support line, many coming from seniors feeling scared, vulnerable, and lonely. And Lori Hassel, the Director of Crisis and Short-Term Interventions at CMHA, says it was an issue even before the pandemic, We were already hearing from a lot of seniors who would call every day just to talk to someone. Well, a $10,000 grant from United Way through the Government of Canada's Senior Response Fund helped CMHC launch Friendly Callers, a new outreach program matching trained volunteers with seniors across Elgin and Middlesex counties. The weekly call was a chance to check in and connect seniors to local services like Meals on Wheels, neighborhood-based resources, or the City of London Age-Friendly Network to ensure they were getting the support they needed. And it says there's so much research now about the impact of loneliness on physical and mental health. Social connection is the antidote. And I just wanted to ask the minister if this story reflects some of what she has heard about how our government funding through this pandemic has helped seniors across the country.
Thank you very much for that question, because absolutely, these are the amazing, inspirational stories that I've been hearing all across the country in every corner of how people have stepped up to support each other, and especially stepped up to support seniors, and that they are very grateful for the fact that the government also stepped up, enhancing the funding. So New Horizons for Seniors had already launched in January when the pandemic hit. We allowed organizations to change their programming very quickly, because where they would have brought people together in a facility, now they had to try to find a way to support them in their own homes and virtually. And that is exactly what happened. And that happened because we allowed them to transform their programs and use the money in another way. We also enhanced the program with another $20 million to be able to provide, in addition to the money this year, provide 5,000 projects that have been supporting seniors from coast to coast to coast in urban and rural areas, rural and remote. This is something I'm especially proud that the government did recognize very early where the challenges were. They were listening to the groups and found a way through enhanced funding and changes in the program to be able to get those organizations to step up and support seniors across the country. So thank you very much for that. It's been really inspirational, the stories that I've heard. And we didn't just do it with New Horizons. We did it with funding through United Way. We did it through emergency community support funding. It was $500 million that got provided to community support organizations to help vulnerable Canadians across Canada. And we should feel very proud of the work that's been done. And I'm certainly proud of the organizations that have stepped up to do those services. Thank you.
Yes, and I know one local group, they do crocheting in London, and all of these seniors who hadn't even heard of this program are really being helped, just getting that day-to-day connection. But I'm hoping that we can make sure that other groups know about this program and know about all the programs that our government is doing. Is there any way that we can increase the information so that people will know that the money is there?
So that's a very good question. We work very hard to get information out to community groups, and you are part of that network of communication through your own community groups. We have a vast network of stakeholder organizations that we work with, and we are constantly providing newsletters and asking them to get them out to seniors and to seniors organizations. So it is work that's ongoing, obviously connecting through to local papers, local radio stations. These are where often seniors are tapped in, making sure that we're not just going to the national media, we're going to the local media, letting them know that these organizations are out there and that they just need to do a little bit of digging. If somebody hasn't already found them, then they need to reach out. And we're asking all of you to be involved in that, making sure that the seniors in your communities know about the organizations that are serving them and they get the help they need.
The other question I had was about something you mentioned in your opening about the Age Well at Home. Briefly, because I think we only have about 45 seconds, how will this impact older seniors as you see it?
Well, thank you very much, because as seniors get older, they get more frail, they have more challenges meeting the needs of staying in their homes. And so we hear they do not want to go into long-term care. They want to stay in their home as long as possible. So we are creating this program to service that need. I heard it across the country, to make sure that seniors can get the support that they need in their homes, especially vulnerable and low-income seniors who can't afford to pay for help and are sometimes forced into long-term care just because they need somebody to help them make meals or do cleaning or do their laundry, help them get groceries. These are things that community groups are involved in, and we're going to be helping them provide more of that support to seniors who want to stay in their homes.
Thank you, Minister.
Thank you.
Thank you, Ms. Young. Suite, Madame Chabot.
Madame Chabot, 6 minutes, please. Thank you. Thank you very much, Chair. I'm going to give my time to my colleague from Shefford, Madame Larouche. You have the floor, Madame Larouche. Thank you very much, Chair, and thank you also to my colleague, Madame Chabot. It's a pleasure for me to be here at the HUMA Committee. Let me get to the essentials. First of all, Madam Minister, it's very important that you are here with us today. To hear what the Minister for Seniors has to say. We heard and talked about the seniors during the past election campaign in Quebec, but there was a divergence of opinion. There was $110 that was proposed as of 65 years of age, and not waiting for 75 years of age to increase the benefit. I asked questions to you in the House about this as to why you didn't increase the old age security for those who were under 75. And you spoke with me personally, and you said it was a good question. But then the pandemic occurred, and people were isolated. The taxes occurred for COVID. Rises in the cost of transportation, in the cost of having people help you at home. Costs were being raised everywhere. Help was offered to people to be able to meet these new costs, but not for seniors. And now $500 is being offered, but only those who have the GIS, but those who do not have it will only receive a $300 check. So there's a lot of frustration out there, Madam Minister. I would just finish by saying that after having spoken about this in the speech from the throne last fall, and also bringing in the budget with the 10% increase as of 75 years of age, only in 2022, and a $500 check in the August of 2021. You know, Madam Minister, seniors, where I come from, seniors feel that this is really insufficient. Their reality is different. What the seniors groups at home tell me is for them to be able to age well at home, to be able to survive, they have to have an increase in the OAS for all people who are 65 years of age and older. And it's, you know, once you stop working at 65, there are needs. You do have some, you spoke to that continue to work, but there are many who do not. Here's a question. If at 65 years of age, I want to ask you this question. Do you have an estimate of what it will cost this particular segment of the senior society between 64 and 75? Do you have figures that you can compare to give us an idea? Do you have figures? Did you study those figures when you came to your conclusion?
So I want to thank you very much and your colleague. Every time you stand up in the House, I get excited that I might be getting a question on seniors and have a chance to share a bit of the work that we've been doing. So I always look forward to your questions. So thank you. You set a lot of elements in motion there in your question, and I do want to make sure that we just touch on a few of them. When we were considering, so let's go back to early days in the Liberal government. And what we have been doing is building up measures that have been enhancing the financial security for seniors, starting back with reversing the conservative change. They were, quote, modernizing the pension system, and they increased OAS eligibility to 67. Right away, we saw there that early pensioners
Madame la ministre, je vous donne...
Madam Minister, I just want to, Madame LaRouche, you have used 3.5 minutes for your question. You have to give the minister an opportunity to be able to answer and to use the rest of the time.
There. Okay. I just wanted to make sure that you understand that none of these things are done in isolation. They're done as part of a series of steps that we have been taking to enhance the financial security of seniors. And that has resulted, it's provided results. We have seen a reduction of 11% in seniors in seniors' poverty. So these are important things. The facts speak for themselves. We are making changes that are making a difference in the lives of seniors. So right away, the first thing we did was make sure that those seniors 65 to 67 weren't going to be disadvantaged when they couldn't work any longer or were not able to work any longer, and they wouldn't be getting a pension, which they would be relying on. So that was the first step. The second one was looking at very vulnerable seniors, our lowest income seniors, single seniors, and being able to help them by providing almost $1,000. It was 10% improvement enhancement to the GIS, guaranteed income supplement for them. We also enhance the pension system, CPP, by it'll be providing over 50% increase for future seniors, and Quebec stepped up and mirrored that. So these are steps that we've been doing. And just so that you know, for the low income seniors on guaranteed income supplement, those seniors now, we changed the eligibility criteria. There's quite a few things that we've been doing to try to help seniors. Now let's get on to what we did during the pandemic, because you touched on that. That was important to make sure that we provided seniors with support that were dealing with extra costs, needing to get services because they were isolating at home. And so those seniors were, as you mentioned, provided $300 and $200, an additional $200 if they were on guaranteed income supplement. So that is what we were doing during the pandemic. But it wasn't just about money. Seniors were telling us it wasn't, some of them had money, but they needed help.
Now I'm going to interrupt, Minister.
You're going to interrupt. I run out of time?
Go ahead and wrap it up. Just finish your thought. Yeah.
So very quickly, I just want to make sure that it is understood that these are steps that have been building. So we haven't been ignoring any seniors. We've been building on a package, and now we're addressing, as we promised in our platform, to help seniors that are older, that are facing more challenges and more costs, healthcare costs, and need help because they are running out of their savings. They're living longer. Thank you.
Thank you, Minister. Merci, Madame LaRouche. Next.
Thank you, Madame LaRouche.
Please, for 6 minutes.
Yes, thank you so much, Chair, and I'd like to thank the Minister for joining us today. You mentioned the $300 and $200. We're now at year 2 of the pandemic, and your government, again, has only provided a one-time $300 payment for those who receive OAS, and an additional $200 for individuals receiving GIS. This equates to providing most seniors the most at risk during this time with just $17.65 per month in support. $17.65 a month in support. And when you match that, I find this concerning because when you match that with the $120 million in support for Imperial Oil, and the $70 million for Husky Energy, as two examples, your government has shown a real disregard for seniors from my perspective. Why do you believe that it's appropriate to provide seniors with such little direct support during the pandemic when they've been the most impact, yet you have millions and millions, in fact, billions, $18 billion for TMX pipeline of support for big oil and big corporations?
Thank you very much for the question. And I think you're comparing to the wage subsidy that we provided to organizations to try to help them keep employees on the payroll, which is very important for those not to lose their jobs and stay connected to their employers during challenging times. What we've done for seniors is mischaracterized the way you've presented it. So for the lowest income seniors, the ones that you're talking about, they were provided $300 and then an additional $200 if they're on guaranteed income supplement, which is our lowest income seniors. And just to be clear, if you add that to the GST top up that was provided, it would have provided a low income senior couple over $1,500 of tax-free money to help them to get through. That is not an insignificant amount of assistance. And that was providing double the amount of money that was committed in our platform to help seniors. So that is something that is really significant. And as I was saying before in the previous question, it's not just all about money. We put $1 billion on the table for community groups to help seniors get meals, to get help, to getting to medical appointments, to be able to get tablets. They actually provided tablets and low cost, even no cost, access to the internet and services for free so that they could get the supports that they need. And we were able to pay in the early days for volunteers to go out there and connect with seniors and help deliver services, supports, and food to them. So $500 million of on-the-ground support plus direct tax-free funding to support seniors was a significant amount of support that we provided to Canadian seniors.
Minister, $17.65 in addition per month. So in 2021, the budget implementation bill, your government has proposed providing a one-time payment of $500 in August 2021 to OAS for those 75 years of age and older, and increasing the OAS for individuals 75 and over by 10% as of July 2022 or 2022. If the government is trying to target seniors most in need, might I add mostly women who don't benefit from a pension, why have you not specifically aimed OAS increases to low-income seniors?
Thank you very much for the question. And I do want to just touch back on the math that you've quoted yet again. That math that you keep quoting does not reflect the reality of what seniors did. The low-income seniors did receive. When you add the GST top-up and you add the GST,
Minister, can you please answer my question? You're not answering my question.
No, of course I will.
Thank you.
I'll be happy to do so, but I do need to correct.
I've asked you another question, Minister. Thank you.
I know, but I do need to correct errors when they're restated. So one of the things that is important, if you look at the measure for those seniors 75 and above, the seniors, we have more women. Women tend to outlive men. Women tend to have spent time looking after the kids, and therefore their pensions are not as good. And when their partners pass, unfortunately, 60%, they get a 60% reduction in that pension, and often many didn't have much of their own pension. So what we are seeing with our measure of 75 and above, for those seniors, it is affecting the women more
Minister,
than men.
What research study did you use? What research model did you use to determine that seniors, particularly we know a certain group, certainly in the BIPOC community, have a shorter life expectancy, that seniors should only receive the increase at 75 years of age? We know that there's many seniors that are living in poverty between ages of 65 and 74. Why are they being excluded?
A brief answer, if you could, Minister.
So very brief. You have to take this measure in conjunction with the other measures that we were doing all along to help seniors financial security. We already took a step to help seniors, the lowest income seniors on guaranteed income supplement. And then in budget 2019, we also helped further by changing the earnings exemption. So there's steps that we've been taking to look after those that were on low income seniors, and steps now that we're taking to support the older seniors that are facing the real issues of running out of the savings because they're living longer than ever before, and they're facing more disabilities, facing being widowed, and real financial risk of running out of their savings. Thank you.
Thank you, Minister.
Zahnd. Thank you, Minister. Next, Ms. Doncho, please, for 5 minutes.
Thank you, Chair, and thank you, Minister, for being here for our study on the impact of COVID-19 on seniors. I do want to change it up a little bit. There's been a lot of talk about finances and spending, but I want to speak to you, Minister, today about isolation for seniors and a few of your thoughts in that regard. And just to begin, I wanted to quote one of our expert witnesses in our first meeting a few weeks back. Her name was Miss Laura Tamblin-Watts of the Canadian National Seniors Advocacy Organization. I'm sure you know her very well. She said, and I quote, in regards to being asked about the impact of isolation on seniors, she said, "It has been a misery for older people across this country, whether it be individuals left in their homes and socially isolated from family, friends and neighbors, faith communities, exercise, daily connections, or at the most extreme level, of course, in long-term care." She went on to say that older people are suffering untold amounts of physical deterioration. In long-term and residential care facilities, we've actually been able to measure it, she said. So we know that their bodies are getting less strong. We know that cognitive impairment has been significantly affected. People who are more able mentally are now less able mentally. That again can be measured on dementia scales or other forms of cognitive impairment. We also know that mental health has deteriorated enormously, and particularly for those in long-term care, the average length of stay until they pass away is 18 months, and this has almost been the rest of their lives in terms of isolation. So, and I quote, "It has been devastating." So this is the situation facing seniors, particularly those living alone in long-term care under the past 14 months, and your government has been responsible for this country in that time. And I'd like to know, and I have many seniors and many folks in my riding who advocate on behalf of their aging parents and grandparents, what are the concrete steps you have taken to address the incredible impacts on seniors because of isolation during the pandemic?
Thank you very much for that excellent question. And I do want to say how much I respect Laura Tamblin-Watt. She's excellent, and she's definitely one of the stakeholders that I stay connected with for her opinions and thoughts on things. In terms of long-term care, just so that you know, this is not something that I'm not familiar with. My mother-in-law was in long-term care last year and passed away after not very long in long-term care. She went in February and we lost her in June. So she wasn't in very long. And part of the reason is because she lost hope. She couldn't see family. She'd been with her husband every day for the bulk of her life. And we expected that when she went into long-term care right before the pandemic hit, that her husband, who was just down in the next building, was going to be able to go and have breakfast and lunch and dinner with her every day and be with her. And that was probably the only way that she was going to eat, to have the support. So we totally appreciate the circumstances that have happened to seniors and the decline, the precipitous decline that we've seen in seniors that have been isolated in long-term care. And so I've been working with my colleagues across the provinces and territories to find ways that we can get caregivers and get family members back in long-term care safely, so that they, and that was one of the reasons, obviously, that was important to get them vaccinated quickly, get workers in long-term care vaccinated quickly. And also we've been providing support through groups that have been providing tablets. We've been providing support to long-term care facilities so they can get tablets in there. And as you know, we've also been working in trying to get more of the PSWs, because what was actually happening was one PSW in my mother-in-law's building, his whole day was spent basically going around with a tablet, connecting with families, because it's really important. So we needed to get the resources, working with provinces and territories.
I appreciate the new technology. I appreciate the new technology for seniors. I also have very elderly grandparents who haven't been able to master the new technology, unfortunately. So that is difficult for us. But you mentioned vaccines, and I do appreciate that we are getting more vaccines now. I do believe had your government procured more in January and February, we would have seen perhaps less restrictions on our long-term care. But Miss Laura Tamblyn, as you mentioned, you know her, she mentioned when I asked her about what could be done, she said that the other piece I would offer is that once people are vaccinated for COVID-19, we need to loosen these restrictions, specifically in terms of seniors of long-term care. Could you comment on that?
So as you know, the jurisdiction for long-term care and for healthcare is in the provinces and territories' jurisdiction. We have been providing vaccines, and we've also been providing test kits, rapid test kits, and a new technology.
But have you provided any recommendations, pardon me, to your counterparts?
Very quickly, Minister, we're out of time. Yep.
We have been providing recommendations through not through us, but through the health tables, and also through NACI and through the science. That's not something that, it's not a political decision. It's something that's being done with the scientists. Immunologists and virologists are making recommendations, and that's the challenge. It's trying to keep people safe, but also provide supports to be able to get them through these challenging times where they can't meet. And like you said, there are those that can't master the technology, which is why sometimes providing extra support to have someone help them come in the room and do it with them, which would be PSWs and those that are working in those facilities, to be able to have some time to help them connect with family members. But it's not enough. It's not good enough. We need to do better. And we're constantly looking at ways to,
Thank you, Minister,
to help.
Thank you very much.
Thank you.
Thank you, Ms. Doncho. Thank you, Minister. Mr. Long, please, for 5 minutes.
Thank you, Chair. Good afternoon to my colleagues, and good afternoon, Minister Schultz. It's great to have you back on HUMA again. I too want to just very quickly take exception to MP Gazan's comments on the $17.65 a month for seniors. That is absolutely not accurate. We gave a $300 payment to seniors receiving the OAS. If you got the GIS, you got an additional $200. You got your GST return, which would actually equal almost $100 a month top up for seniors, not $17.65. So again, I want to try to clarify that. I had a 66-year-old senior in my office actually this afternoon, Minister, and she was exceptionally grateful for what we have done as a government. She's a low-income single senior. She was thrilled with obviously the 10% increase that we gave seniors right off the bat in 2015. She was also thrilled that we were in government because obviously the Conservatives were going to up the age to 67 years old. She wouldn't have even been eligible for anything if a Conservative government was still in power. So, very, very appreciative. So we talked about the benefits we've given. We also talked about the additional 10% for OAS for seniors over 75. Obviously, she's not there yet, but she certainly understood the reasons why. And I just want you to comment on, the things that we've done and, all those things added together, how they do make big differences for seniors making ends meet. I just wonder if you could give me your thoughts and your comments on that. Thanks, Minister.
Well, thank you very much. And you're absolutely right that it is a sequence of steps that our government has been taking to improve the financial security of seniors. And as I said before, it has resulted in real results. 11% reduction is significant. There's always more to be done, but it is true. You have to look at the 10% increase in in GIS. You also have to look at the changes that we made to the GIS earnings exemption. There are many seniors that were doing small self-employment, selling things that they made, or just doing very infrequent services that allowed them to be able to make some income. And we made changes in 2019, in the budget of 2019, that allowed them to not have any clawback up to $5,000, and that includes self-employment, which was not the case before. And between $5,000 and $15,000, they would only get a 50% clawback. It's a significant help to be able to allow seniors that are struggling to keep more of the money in their pocket. There's something else that we haven't talked about, and we need to, but we've also raised the basic personal amount over 4 years. So that's going to help 4 million seniors save about $300 if you're a single and $600 if you're a couple. So, you've got to look at all the steps that we've been doing that add up to real savings for seniors, real help, and real financial security for them as they're aging. And don't forget, for future seniors, the 50% increase in outcomes, in pension outcomes in CPP. That's a very significant enhancement that we've made to make sure future seniors have the funding that they need for a secure retirement. There's so much more that we've been doing that isn't just about money and putting money in their pockets, but it's also making sure that we have better supports in the community to help seniors when they need that help. And that's why I'm really pleased with the Age Well at Home program, because, this is something I heard a lot across the country. We don't want to go into long-term care. We're really glad that you're helping in long-term care, because those seniors need to be well cared for and treated with respect. But I don't want to go into long-term care. I want to stay in my home. What are you going to do to help me stay in my home? And so this is why this Age Well at Home program, I'm very excited about it, because it will be addressing those needs of seniors that are getting more frail and needing more support to be able to stay in their homes. I hear a lot about snow shoveling and mowing and cleaning and meal making and laundry, and these are things that can be supported by the community, by volunteers, and we can help keep seniors happy in their own homes rather than having to go into long-term care.
Thank you, Mr. Long. Thank you, Minister.
Thank you, Minister.
Suite le bloc.
And now the Bloc Québécois, Madame Larouche, I presume. Yes, 2.5 minutes. Yes, thank you very much, Chair. Very quickly, Mr. Chair, $4 billion is the cost that we in the Bloc Québécois have estimated to be the cost for those between the 65 and 75 who won't get the increase. Now, here's my question. For $4 billion, what prevents you, Madam Minister, from giving that increase for those under 75?
So what I wanted to make clear, and I didn't get to say it last time, but just to put in perspective, if you look at what was provided to seniors in 2020 and what will be provided in 2021, that will add up to $5.5 billion in direct financial support to seniors, and that is over $1.6 billion more than we had committed to in our platform. So we are stepping up and providing significant support to seniors, more than we promised in our platform.
Once again, Chair. The Minister, this is just a one-time help that is being offered, but we are looking for here is long-term help over a period of time. You spoke about your parents, your relatives, but really, I believe that it should be from reduced to 65 years of age, not just 75 years of age. It seems to me that when you talk about growing old at home, indignity, as you say, should there not be this increase? there's a great deal more care that is required for somebody over 75, yes, but there is care required for people under 75. We've heard a lot from groups that have told us, and they are under 75 years of age, that they really need help and they really need an increase in the OAS for them, and not just through New Horizons. So what are you going to do for that group?
So thank you very much. Again, I just wanted to, let you know, in 2019 and 2020, the government provided $56.3 billion in old age security benefits to 6.5 million beneficiaries. So I'm just trying to get the perspective of how much money the federal government provides to seniors through old age security. This is a very massive program. And one of the things that people need to remember is that, and I heard it from you all, that when we're looking at programs for seniors, that's just one piece of program that we are doing. You mentioned some of the others like New Horizons. You mentioned now we're going to have an Age Well at Home. You have to remember that we were also being asked to step up and support national long-term care standards. So we put $3 billion on the table to be able to help the provinces and territories to enact standards and improve outcomes in those facilities. We also provided rapid stream investments in terms of the buildings, because we know that not only was it infection prevention control that was required to be enhanced, we needed to enhance some of the abilities of the buildings to keep people safe through ventilation and isolation. So these are things that we're already doing, and we're stepping up to provide that funding. So we're multi-billions of dollars more, and you're just looking at one piece. You're looking just at the OAS, and that's not what the government's doing.
Thank you, Minister. Next, Ms. Gazan, please, for 2.5 minutes.
Yes, thank you so much, Chair. I know that you spoke a little bit about this, Minister, about how Budget 2021 proposes providing $90 million over 3 years, beginning in the 2021-2022 to Employment and Social Development Canada to launch the Age Well at Home initiative, which would, in quote, assist community-based organizations in providing practical support that helps low-income and otherwise vulnerable seniors, including by, in quotes, matching seniors with volunteers who can help with meal preparations, home maintenance, daily errands, yard work, and transportation. Sounds a little like the volunteering. Too bad we're not looking at paying people a living wage. Here's my question. Why has the government chosen to rely on a charity of volunteers to support low-income seniors, something that needs real investment, rather than make the investments that are needed to ensure the human rights of older Canadians are met?
So thank you very much for the question. I want to make sure that we're remembering the $6 billion that the federal government has provided and is providing to the provinces and territories to help with home care. And this is where, that seniors are getting paid help to be able to support them in their homes and recover from illness and injury and be able to stay in their homes. So that's $6 billion that the government provided. This is a program that's just additional support to help in non-health related situations, where organizations are already there. I think you've probably heard of Meals on Wheels. You've heard of all sorts of organizations that are already there in the community supporting seniors. And this is to expand that opportunity to provide them some financial support to organize, mobilize more volunteers, and be able to get that help. This is, people want to help, and this is a way to help mobilize that support.
Minister, I would disagree. I think ensuring that all seniors can live in dignity is a human rights issue, and certainly impacts to health. Again, not answering my question. Why are you spending $90 million on a volunteer program rather than paying people a living wage to ensure that seniors can get the care they need to live with human rights and dignity in this country?
Short answer, please, Minister. We're out of time.
Okay, we are definitely supporting seniors in a variety of different ways. We're basically helping in in providing support to get more PSWs into the field to be able to help in not only long-term care but in home care. And so we are doing a variety of different measures. We're also putting more money into the National Housing Strategy to be able to create more livable spaces for seniors, affordable livable spaces for seniors. So, you know, you've got housing, you've got wage subsidies, you've got programs, you've got direct financial support. The government is there for seniors, and we will always be there for seniors, and we're going to continue to be there. So I'm looking forward to your recommendations so we can see what else we need to do. Thank you.
Thank you, Minister.
Thank you, Minister.
Mr. Tucker, please, for 5 minutes.
Thank you very much. Minister, the seniors I've been meeting with tell a different story. You brag about over $1,000 increase for the year, for last year, over the different buckets of money that you did for one-time payments. But the seniors I've been talking to, they read reports in the news about 40,000 15-year-olds getting approved for CERB at $2,000 a month. Not yearly, monthly. They hear about 16-year-olds. There's over 92,000 that have been approved. And of 17-year-olds living at home, there was 184,000 kids getting CERB last year. Do you think that's fair?
So one of the things our government will not do is pit one group against another. We made sure that CERB was there, not only for youth that could not work and were unable to potentially get the income that they needed to pay for their studies and continue on with their education, but we made sure that seniors were also able to access CERB. So even if they got their pensions, their CPP, OAS, they could still qualify for CERB as long as they had a loss of employment income because of the COVID pandemic, or they had to stay home because they were isolating because of risk factors.
Minister, with respect, it's the decisions in this budget you should be ashamed of. If you're saying we're pitting one against the other, but these are the decisions that the Liberals made, is that we've had, hundreds of thousands of kids living at home get approved for emergency relief and pittance for seniors of, what do you say, with just over $1,000 increase for the year in over all the programs. I shudder to think of what the seniors you've been talking to and what you're hearing, because what I'm hearing is that you are pitting one segment against the other.
I think it's really unfortunate that the seniors that you're talking to have had their information twisted so that they are basically looking at saying that the youth don't deserve to be supported when they've lost their jobs. Listen, I'm the Minister of Seniors. I'm not the Minister of Youth, but I can tell you from the youth that I know in my community, it has been very, very rough on them. They would normally be able to have a summer job at a local restaurant or a carnival or some. Normally, it would be those that are servicing the service industry that is really shut down, and they don't have that ability now to make the funding that they need to be able to carry on with their education. And there may be some that accessed it that shouldn't have, and that will be determined in time through the CRA. But right now, we were there to support youth. We were there to support seniors, Canadians, and businesses, and I'm proud that we were there to support them. That's helped us get through.
If you're wondering where they're getting their information from, I'll just read quickly from the National Post, so pretty reputable national news outlet. The documents show that 40,630 15-year-olds were approved for the benefit. The government paid out $81.2 million for that group. There are 92,784 16-year-olds approved, receiving nearly $186 million. And 184,576 17-year-olds received $369 million. That's where they're getting their news from, or information, as you call it. And it's concerning. It's concerning that we would not help seniors out during this crisis at the same level as we're helping out students living at home. I'm just going to switch gears just briefly on the dollar amounts that you talk about. $5 billion here, $10 billion here that the Liberals like to gloat about. It's all printed money. It's all money that is printed, and regimes across the world that have tried to print money out of their fiscal crisis, it ends poorly for society. And I was wondering, do you think seniors are worried about inflation right now?
I think everybody's worried about inflation, but more than anything, people were worried about getting through the pandemic and needing to have supports to be able to do that. I really do want to go back, because when I was young, I was 15, I needed a job to help pay for my family. We were not well off, and we all ended up working. I was working, and I was working at 15. There's a lot of young people in this country that are supporting themselves, supporting their families, supporting their education. Now, you might say it's a little early at 15 to be supporting your education, but there are a lot of funds that you need to be able to exist, paying your food, paying your clothes. And these are things that families sometimes need to rely on their younger teenagers to help with. So I think, Corey, it's really unfortunate that you're making a judgment call that all youth are somehow in a position to be able to have access. That is not true, and I think that it's unfortunate. Maybe it's because of just a different upbringing, but I can tell you, I really appreciated my job, and if I had lost it when I was 15, it would have made it very, very difficult for me. And I know that is the story of young people across the country. So let's go back to seniors, because we are not doing one versus the other. Seniors were able to access the same supports as youth and Canadians. If they worked and they lost their income and they were making about over $5,000 a year, they would have been able to access those benefits as well. And so this is important, that we are fair and that we're treating everybody well. Properly.
Thank you, Minister, and thank you, Mr. Tucker.
The last question will be for Mr. Lauzon. Thank you very much, Chair, and thank you, Madam Minister, for being with us here today. This is a very important study on seniors, and we know that you are dedicated to seniors. You always have been. You're going to agree with me to say, when I say that the important role that you have been playing since the very outset of your mandate is one of reassurance to seniors. In my riding, seniors are well represented by a variety of seniors groups, but we work with the FADOC, we work with others, and contrary to the Bloc Québécois that sows disinformation, that creates anxiety amongst seniors, I know that you've always been there, Madam Minister, to support seniors. You gave some important figures earlier on. 57% women who were vulnerable between 65 and 75 years of age. You also said they were widows. 59% had incomes that were much lower than others. And also the costs in health that have increased 67% for those people 80 years or over, and 80% increase in the costs in staying at home. These are figures that are very important. Do you agree then that we have been able to achieve what we said we would do, but we have been able to help the most vulnerable rather, in society? Have we achieved that, as we said?
Thank you very much. And the answer is yes. There is always more to do. But yes, we should feel proud of the work that we've done so far. And obviously, I look forward to the report and the recommendations that you're going to bring forward. I very much look forward to my conversations with stakeholders like FADOC and others that are able to share their perspectives as we move forward, continuing to work on the issues that are of importance to seniors, and specifically making sure that we address their financial security and their needs. Thank you.
Merci beaucoup, Madame la.
Thank you, Madam Minister. You know, during the questions that we heard today, we heard you say often that we as a government want to help the senior citizens directly and indirectly. You have a program that's in place, which is the New Horizons program, and you have made some changes to the New Horizons program. But you took the time to consult all the stakeholders before doing so. So can you tell us about the changes that you made to New Horizons? What was the process of change that you applied to that program?
Thank you very much for that question. It is, I want to thank all MPs from all parties that took part last year very early on, gave us input on how we can improve the New Horizons for Seniors program. We were able to incorporate that so that we've got a better distribution across the country. We've got making sure that we've got those in rural and remote communities get an opportunity to get projects. And so I want to thank all the members of Parliament, because all of the work that they brought forward, those recommendations were incorporated, and they have resulted in over 5,000 projects across Canada that have addressed, those in rural, remote, those that are more vulnerable, those in different cultural groups. We got a much better distribution of projects across the country to help support seniors, and I'm very proud of the work that all MPs did to get those quality projects in the application, and we ended up with really excellent results across Canada. Thank you.
Merci, mais vous avez
Thank you. But you dealt with a variety of subjects in questions that were asked of you today. But we didn't really talk about elder abuse. We've invested some $50 million in preventing elder abuse. We want to be sure that all seniors live in safety, but tell us about what your government is doing to prevent elder abuse.
Thank you very much for that important question. Elder abuse in all its forms is totally unacceptable, and it is an issue that our government takes very seriously. And we are working on initiatives to combat elder abuse, including strengthening the law, creating a national definition, and better data collection. And this builds on the work that was already underway by the National Seniors Council, who examined the issue through the New Horizons program, which is one of the elements is addressing elder abuse and raising awareness. And through the budget 2021, our government will provide $50 million over 5 years to promote safe relationships and prevent family violence, and that's including elder abuse. So our government will continue working on this issue and strengthen Canada's elder abuse, our approach to elder abuse. It's very important.
Thank you, Minister. Merci, Monsieur Lauzon.
Thank you, Mr. Lauzon.
Minister, that completes a little over an hour. We are very grateful to you for being with us and for bearing with us with our late start and the very comprehensive and patient way that you responded to our questions. We appreciate your openness to receive and be guided by the recommendations that come from this report. So, as I love to say, you are welcome to stay, but you're free to go.
Thank you.
Thanks again. Colleagues, we're going to suspend for a couple of minutes just to make sure that we're all set for the second panel. Okay.
Thank you very much, Chair. It was a real pleasure. I always appreciate the opportunity to come and share a bit of knowledge and hear from you. Thank you.
Thank you, Minister. Committee is meeting on its study of the impact of COVID-19 on seniors. I'd like to welcome our witnesses to continue our discussion. Once again, we have Alexis Conrad, Senior Assistant Deputy Minister, Annette Gibbons, Associate Deputy Minister, and Janet Goulding, Associate Assistant Deputy Minister. Unless you have an opening statement ready, I think we're going to go right into questions. Is there?
We do not, Mr. Chair.
Excellent. Okay, then we're going to start with Ms. Falk for the Conservatives for 6 minutes. Ms. Falk, you have the floor.
Thank you, Chair. And I'd like to thank all of you for being available today to come to our committee as we study the impact that COVID-19 has had on seniors and is having on seniors, and the reach that the federal government programs have had. In the recent budget, proposed to provide $400 million to create a temporary community services recovery fund for charities and nonprofits. Will charities and nonprofits serving seniors been eligible and or prioritized in the program?
They will certainly be eligible. I'll turn to Janet to provide a bit more on this.
So thank you, Mr. Chair, for the question. The Community Services Support Fund will definitely be available to senior serving organizations who are either charities or nonprofits. The program is still under design, and we're looking at how to make sure that those dollars are made available to the most vulnerable Canadians to continue to support our charitable and nonprofit sector as they move through, we hope, to the post-pandemic period very shortly.
Okay, thank you. Do you guys have, or has there been conversations about what activities will be eligible for funding?
So the new recovery fund is focused on supporting charities and nonprofits who are looking to modernize or adapt or move forward with new programming or new processes that will help them move forward in the post-recovery period. So we do anticipate having those details eligible in the coming months.
So is there also discussions, or I guess, is there a timeline that the intake of applications will begin?
So the program will be, we intend to run the program using community-based intermediaries who have national reach. There will be a public call for proposals to identify the organizations that will administer the program. So all of those details are still to come.
Okay, thank you. The staffing crisis in long-term care has exacerbated the impact of COVID-19 on the health of our seniors. And there is a shortage of healthcare and care workers across the country. In the fall economic statement, funds were allocated to train 4,000 support workers across the country. This committee received a written response to my previous inquiries on the topic that recruitment for this training started in April, with placements beginning as early as June 2021. Given those dates, the program should be underway. Can you please provide the committee with an update on the enrollment of this program?
Go ahead, Alexis.
Thanks, Mr. Chair. There's actually not much more I can say than that was provided to the committee before. The program is moving ahead. I think there's been announcements around funding and targets, and working with Colleges and Institutes Canada to train thousands of new personal support workers. We're still in that period, obviously, that the committee received information about between April and June. But we would be happy to follow up with some specific information to the committee when something does change.
Perfect. I have a few other questions as well, but if I can't get that information, I just like the questions on record so that when the information becomes available, the department could provide that if possible. If you could provide a breakdown of enrollment across the country, what colleges are running this federal program? Will the department be tracking the completion rate of this program? Or how will the success of the program be measured? How does this program measure up against other investments in training like the Ontario Accelerated PSW program? And are these programs complementary?
We'll come back to you then.
Perfect. I appreciate that. I want to also touch on AgeWell. I know the minister did mention, and it was brought up in our previous hour, We do know that Budget 2021 announced $90 million over 3 years to launch the Age Well at Home initiative, and this would be helping seniors age in place. And we do know that that is very important, especially for seniors attaining and having autonomy. So I'm just wondering, how is this program going to achieve that?
So we're still developing the detailed program parameters for it, but the goal is to fund community serving organizations at a regional level, at a national level, to try to develop and put in place best practices to support seniors in the community. We have the New Horizons program platform, which we will sort of use as a base for the delivery of this new program. We've got a whole infrastructure built around it that involves us in a relationship with various organizations across the country who are serving seniors. So we'll certainly be building on that foundation.
Is there a goal for a deadline?
A deadline for a call for proposals, you mean?
Yeah. Because I guess if it's still underway, if it's still being developed, but was announced in the budget.
So we're probably will have a couple of calls for proposals under the program, and we really do want to launch one in this fiscal year. So we're working very hard to reach that objective.
And who is going to be targeted for eligible funding? Would it be people in specific, seniors in specific, or individually, or is it going to be the organization?
It would be organizations who would apply. Yeah.
And then what type of activities is the department exploring that would be eligible for funding?
So as the minister noted, organizations that are providing various supports to seniors in the community would be provided funding to organize those sorts of supports. There's I came up with the minister that volunteer model is certainly a model that's out in the community a lot already at local levels. And so building and strengthening some of those activities is certainly something we have in mind. But we're also looking at trying to support the development and rollout of best practices. So where something has been proven to work, to try to support organizations perhaps in another part of the country to be able to provide a similar service. So really trying to look at what's not reinvent the wheel, but look at some of the great success stories that are out there and try to support organizations in different areas different regions to build on those kinds of models.
Thank you, Ms.
Wonderful.
Falk.
Thank you,
Ms. Givens. Next, Mr. Dong, please, for 6 minutes.
Thank you very much, Chair. And I want to thank all witnesses and officials coming to the committee to give us some answers. I just want to follow up on what MP Falk was asking. We know that aging at home is the wish of a majority of our senior population. We know that the pandemic has posed a greater challenge. I read that today that Angus Reid had a survey out that I noticed 45% of the respondents said it will be it'd be impossible to provide sufficient support for seniors to age at home without considerable help. And looking forward, the budget 2021 talked about the $90 million over 3 years to launch an Age Well at Home initiative. Just following up on the previous question, why did the ministry chose or consider avenue of volunteer service, and do we know if there will be enough volunteer to meet the needs of seniors aging at home?
As the minister noted, there's there's already a great record of volunteer participation in all kinds of community serving organizations, and certainly for seniors, there's a number of very successful ones that are out there. And so, being able to build on that, we know that seniors themselves are very active volunteers in serving each other, and so certainly that's one type of organization or one model I think that we want to provide more support to. There's a great many needs out there and a lot of different ways of supporting the community. So what we're trying to do is to give a little bit of a boost to what's already happening out in the not-for-profit sector, and as I said before, really looking at where there have been success stories in providing supports, providing the profile and the capacity for organizations who right now don't have the resources to be able to build up a function, an activity to serve the community, to give them the boost to do that and to give them models through comparing with what's already happening in other places. There's lots of very interesting things that are happening in communities now that we hear, that they just need a little bit more support to be able to bolster it and to provide sort of a manage a project to build up capacity even further.
I can support that. In my riding of Don Valley North, I know personally quite a few senior that they're helping seniors through Meals on Wheels. They actually are actively recruiting volunteers to cater to the diverse community that we have in the riding. So I hope that we can enact on this very, very quickly to provide those key support. I can't help to ask that what checks will be in place to mitigate the risk of senior abuse, considering that if we expand this program, we'll be recruiting or encouraging more volunteers to come in and serve. Is there any thoughts on that?
Are you referring to the possibility that people involved with the administration and community organizations may be doing?
Just people involved in delivering these programs. A lot of them, will be volunteers. So, is there any background checks and provisions to prevent any risk of senior abuse?
Yeah, that's a great question. I think that because this program will be delivered through projects that these community serving organizations structure, we would be relying on them to make sure that they're doing the kinds of checks that need to be done, and we would provide the support for them to be able to do everything that they need to do to mount a project and be able to provide services to seniors ultimately through volunteers. For example. So, it will be important that they're resourced to be able to do,
That's right.
to manage a volunteer function well.
That's right. I strongly recommend that the resource put in place to mitigate these risk of these happening, because it will bring a bad name to a very good program, which will be discouraging to a lot of volunteers in place. Just very quickly on the New Horizon programs, I hear a lot of community groups that being successful in applying for this funding. Of course, we saw the additional funding put in place last year. And just going forward, is there any way to provide any stability to these community groups in terms of these programs? Because they see that they're catering, it's quite successful. They want to continue doing the good work through with the support of this program.
So the funding is not an operating grant, so it's sort of not. There's no guarantee of a receipt of funding every year. Every year it's a sort of what we call a competitive process, and there's lots of different organizations who are new to the program every year. There are definitely organizations that apply for funding on a renewed basis every year as well, but but the objective of the program is to fund distinct projects as opposed to the ongoing operations of an organization. So a distinct project that meets the needs of the program, that meets the objectives of the program.
Thank you, Ms. Gibbons. Thank you, Mr. Dong. Madame Chabot.
You have 6 minutes, Madame Chabot. Madame Chabot, you have the floor. Thank you very much, Chair. I apologize. There was a little lag. My screen froze. I will begin with a brief preamble that fear is a very poor advisor. I hope I won't frighten you in my questioning. My question deals with the will of the government to affirm in its budget that it would raise the OAS as of 2022 for those 75 years of age or older. Do you know do you know that the OAS as well as the GIS are the first pillar of the system, the pension system in Canada? Yes, certainly they are pillars that are very important for seniors. And do you recognize that the OAS is a system for social protection for those persons who retire as of 64 or 65, whether or not they work? I can't hear. I'm sorry. I'm sorry. I apologize. I'm sorry, Chair. There are conditions. It's not a universal right. There are conditions attached, particularly with respect to the number of years that you have to be a resident in Canada. Yes, yes. But in general, before you get that venerable age, we all receive from the federal government letters saying that we are eligible for the old age security. And for some, it is the only pension that they have. That's the only thing that they have in their retirement because they don't receive anything else from elsewhere or that they didn't work at all. So it's very important for the government to get advice, of course, from its advisors to justify its choices. So on what evidence did you base yourselves to, for the first time in our lives, draw a distinction in the OAS as of 75 years of age rather than 65, given that universal pensions with conditions begin at 65. What evidence did you use? What difference do you see between 73 and 75 years of age? Yes, Chair. The government made a decision to differentiate and to increase the pension for people 75 years and older. And there are factors that the minister just mentioned here in committee about the costs for health care, costs because the spouse had passed away and the surviving spouse is now alone. And so there are additional costs in terms of the cost of living. And also people of 75 and older work far less than somebody younger who is retired. But do you have any evidence? Where's the evidence Can you give us the evidence that would justify what was done, that would justify that me, say, being 73 or 72 or 65, I can't get that pension top-up?
Sorry to interrupt, Madame Chabot. It's just that the translation is not coming through clearly. It's completely, I can't understand a word. Thank you so much.
Okay, I'm not sure, Mr. Viss, but it might be because we might have had two people trying to speak at the same time. Mr. Viss, est-ce que ça va?
Mr. Viss, can you hear me now? Is it okay now? Why would there be two people speaking at the same time? It was you and the witness who were speaking at the same time. So you still have the floor, Madame Chabot, 1 minute and a half. I'm going to give you another example. And I hope that we can obtain that evidence, because as far as I'm concerned, there's nothing that justifies that. It was a political decision. My other question deals with the pandemic. It's a short one. Last year, people received at 65, $300 for the OAS at 65 years of age. This year in August, the same thing will happen. That is this year in August, we're still in a pandemic, but it'll only be at 75 years of age. What justifies this? The August payment is related to the decision to increase the age to 75 years of age in terms of the OAS. It was the change in the pension, but that won't happen until next July 2022. Do I have time? 30 seconds. 30 seconds. In 30 seconds, I can wonder if there are any other measures I could speak to. Elder abuse. Perhaps you could justify the policies in terms of the action plans that exist in the provinces. So did you think about consulting the provinces so that the provinces, say Quebec, for example, could benefit from a transfer from the federal government to assume the responsibility? Very briefly, please. I don't have any comments to make with respect to this subject. I respect the decision on public policy that was made about the OAS. That is it. Thank you, Madame Chabot.
For 6 minutes.
Thank you, Chair, and thank you to all the witnesses today for coming to committee. My first question relates to Manitoba and much of the Western provinces. We know that urban Indigenous peoples, in particular First Nations communities, have been disproportionately impacted by high rates of COVID-19. And this has also been true in the case for Black communities in Canada. My question for your department is, has there been any data collection in relation to the social determinants of health and the impacts of COVID-19 on Indigenous and Black seniors during the pandemic?
I will admit, Mr. Chair, I'm not in a position to expand on that. I know that we're having some discussions with our federal provincial colleagues on data sources and sort of breaking out different populations of seniors by different characteristics, and that's something that we need to improve upon. And we have the federal provincial ministers responsible for seniors are meeting in June, and that's one of the things that officials have put on the agenda for them to discuss. How do we improve that? But the specifics around those data points and the impacts of COVID, I think StatsCan, I can say generally, I think StatsCan has done quite a bit of work to be able to provide very detailed demographic information, but I don't have that at my fingertips.
Yeah, so I was very happy to finally see a robust StatsCan study again. However, as we know, rates of poverty within certain groups of seniors are higher, which is why this data is pretty critical, I think, going forward. And I hope to have a more robust answer the next time. I think it's quite pressing. So going back, and I know you've been asked a lot of questions about this, the government proposed the $500 in August 2021 to OAS pensioners who are 75 years of age and older, and increasing the OAS pension payable to individuals age 75 and over by 10% as of July 2022. Again, going back to research, we also know differences in life expectancy. I mean, these are not secrets. What data was used to determine that this one-time payment of $500 and the 10% increase would be adequate?
As I was saying before, and as the minister spoke earlier, there's a range of different data that were taken into consideration, things like costs, differences in income, differences in labor force participation, and we certainly can send some of those numbers along to the committee, as Madame Chabot asked for. One of the numbers that I have here is that the proportion of seniors with employment income in 2018 was substantially lower among those age 75 and over. This is intuitive, I think, for a lot of people, but it was 15.4% for seniors age 75 and up, compared to 34% of seniors 65 to 74 had employment income. So that's one of the data points that was considered in that decision. The issues of marital status and whether households or couples are sharing expenses, or if there's more likely to be people who are on their own covering their expenses. There's a difference there in terms of seniors over 75. So those are the types of things that were taken into account.
So with all due respect, and I know this is not your decision, but I hope 75-year-olds don't have to work in order to stay off the streets. But in saying that, has there been any sort of exploration of data, research done specifically in regards to women? We know that many women, seniors, do not benefit off a pension. We know that women in their seniors years live at higher rates of poverty. Is this data gender specific? And going further, is this data gender specific? And again, going back to my first question, looking at specific research done with BIPOC communities?
I think some of it is gender specific, and some of it is not, is the short answer to that. And I don't believe that there was detailed analysis at the BIPOC level, but I certainly am happy to go back and check that.
Yeah, I do have some concerns about that because, this was a pretty big decision to leave out individuals 65 to 74 from an increase in an OAS benefit, knowing the high rates of poverty in which seniors live in. And it doesn't seem from your responses, I could be incorrect, that there was a lot of research done in making these kind of critical decisions when the announcement was made in terms of who gets it. And I do agree with many of my colleagues within the committee that there seems to be a two-tiered system being set up for seniors in our country.
Thank you, Ms. Gazan.
Thank you.
We're out of time.
Thank you, Chair. Thank you, everybody.
Mr. Viss, please, for 5 minutes.
Oh, thank you, Mr. Chair. You know what? It was almost exactly a year ago when I believe Madame Conrad, Golding, and Gibbons were talking about OAS at our committee last year. And one of the things the minister said was that the most important thing at that meeting on May 15th, 2020, the most important thing was to get a payment as quickly as possible into the hands of those seniors who are struggling. And that was the objective of the government. It's why we had the one-time payment option to go to old age security recipients and guaranteed income supplement recipients, so we didn't have to make them apply. At the time of our discussion last year, we discussed the merits of OAS recipients receiving $300 even if they were in the upper income levels, and GIS recipients receiving $500. So I was, at the time, it seemed that the minister agreed that, you know what, they made some tough decisions, but they wanted to get that money out quickly. And we wanted to do it as quickly as possible. And at the time, you know what, I accepted that rationale. I didn't like the fact that some people got more money than others and how it was arranged, but I accepted that the money needed to get out the door. So now let's turn to the budget. And there's $500 checks going out this time, but only to seniors over the age of 75. So when did the deputy minister advise the minister that seniors over the age of 75 should be receiving a $500 check? Or did the deputy minister advise the minister to issue $500 checks?
The decisions around the specifics of those, and this was announced in the budget, and so we have a detailed process every year where we work with in the department, providing advice. Ministers make decisions about what to seek in the budget and present that to the Minister of Finance, as you know, and so. All of the discussions that we would have on any file that is going to be the subject of a budget determination, if you will, went through that process, including this one.
So you can't tell me whether or not the department advised the minister to issue $500 checks?
There was a decision. I mean, everything is a conversation, right, with ministers,
but there's a paper record in your department. I'm surely there must have been a memo from, say, the director of policy recommending that seniors receive a $500 check. Was there a memo issued by the director of policy for seniors at your department to issue a $500 check in August?
So I won't get into the details of the back and forth, because those are the recommendations to the minister, and quite honestly, I was not an associate in the department at that time.
But sure, it doesn't matter if you were in the department.
No, I understand. But what I can tell you is that there is a back and forth on budget proposals, and different options are considered, and different options for implementation are considered. And so,
but what I know there's a back and forth, Madame Gibbons, but I do know that department officials also write recommendations, and the minister has the right to either approve or deny that recommendation. So my question is, was there a recommendation to issue a payment in August for seniors over the age of 75 from the policy branch at your department?
So the reason I'm not giving you a specific response is because there is always back and forth about what's possible, the timing of making different changes. And
okay, well, maybe then could you, for all committee members, table the advice given to the minister in advance of the budget, concluding the recommendations for the minister to include in the budget?
And that's part of the budget process, which I'm not.
So I'm going to have to file an ATIP, is what you're saying?
And yes. you may find that it's covered by cabinet confidentiality as well.
But it's a budget, process, and okay. We don't.
Okay, fair point. I'll just, in our previous meeting, Dr. Samir Sinha, the Director of Health Policy Research and co-chair of Ryerson's National Institute on Aging, said it was a bit of an eyebrow raise when we saw the announcement, and that that if it was my decision, I wouldn't have used the old age security mechanism to do that. What's the rationale behind giving all seniors over the age of 75 $500 in August, likely right before an election, I might add, and not to seniors who receive GIS under the age of 75? What's the economic rationale behind that?
So the payment in August is part of an integrated policy decision to increase OAS for people over 75.
Do you think it's acceptable that seniors, so part of that economic rationale is that seniors making over $100,000 need another $500 check from the government?
Okay, you're out of time. A brief response, please, Ms. Gibbons.
Thank you, Mr. Casey.
All I will say is that this is part of the policy decision that was made as part of the budget.
Thank you, Ms. Gibbons. Thank you, Mr. Viss. Next, Mr. Turnbull, please, for 5 minutes.
Thank you, Mr. Chair, and thanks to the witnesses for being here. Really appreciate your responses and all your hard work. I just wanted to, unfortunately, there was some implication earlier by members of the committee that almost implied that somehow, students were getting more than seniors, and I think there was that implication. What I wanted to just ask you as clarification question is, did retired seniors on CPP lose their income as a result of the pandemic?
No, they would not have.
So, not to say that seniors certainly were experiencing income insecurity prior to the pandemic, I'm sure, but it wasn't as a result of the pandemic. Is that right?
Seniors would not have lost the ongoing benefits to which they're entitled. So OAS and CPP, GIS would have all continued as standard. If they had been employed and were eligible for the CERB, many of them did apply for the CERB as well.
That's okay. Thank you for that clarification. So isn't it mostly the case then that the cost of living may have changed? Some of their expenses may have been increased during the pandemic due to the pandemic. Is that true?
So the decision that was made last spring to increase or to provide payments that the minister spoke about, the $300 for OAS, the GIS payment, the GST, those were things intended to support Canadians to deal with some of the extra expenses that they incurred due to the pandemic.
So, and those expenses would have been things like prescription fees and groceries, etc., delivery fees. Is that right?
That's right.
Generally speaking, yeah,
yes,
that's what I heard from seniors in my writing. So the one-time payment was linked to a cost of living increase that was due to some of these added costs that seniors were experiencing. That's the rationale for the one-time payment, right?
That is the rationale, yes.
Okay, that makes sense. And do we know how much that cost of living might have gone up for those particular seniors that would have been impacted by that?
I think that there was certainly analysis with data that we had at the time to sort of try to make an estimate. But I think that some of those decisions were made very quickly in an effort to try to get information out, to get support out to Canadians quickly. So we wouldn't have had exhaustive data sets. But we certainly knew at the time that certain foods were more expensive, for example, as you noted, and taken that into account.
Thank you. And just to be clear here, I am not suggesting that seniors aren't income insecure or needing support, but is it not the case that, like, what government, in history provided, lowered the age of eligibility from 67 to 65? Was that the Liberal government?
Yes, that was.
And which government increased the GIS by $947?
I think your question's rhetorical.
Yeah,
but it was done under this government in 2016, I believe.
Yes, and which government also increased or plans to increase OAS by 10% for seniors over 75?
It's the same.
Right. So, and are there not many other measures that impact the income security of seniors? And we're not saying, I think we heard today from the minister that we haven't cracked the nut or solved the problem, that there's lots more work to do. But does this not show a history of really trying to tackle income insecurity on a national level for seniors across this country? Would you say that's fair to say?
I would say that there have certainly been several initiatives in the last 4 or 5 years that have been focused on increasing the support system for seniors.
Thank you. I know that in the fall economic statement, there was $1 billion committed for the Safe Long-Term Care Fund. What was that funding for?
So I'm going to ask Alexis to speak to that.
Yeah, it's $1 billion to go to provincial governments to help with long-term care, but it is funded through Health Canada, not through our department.
Right. And is it for infection prevention and control mostly?
Those kind of things. I don't have the specifics, but we're happy to provide anything to the committee here. But it is generally a Health Canada transfer.
At your time, Mr. Turnbull.
Thank you for that.
Thank you so much. Suite Madame Chabot pour
2.5 minutes, Madame Chabot. Thank you very much, Chair. In the studies that were done to advise the government, were there any studies done for the government to protect, to increase the OAS as of 65 years of age? What would the effect be? I think, are you speaking about the decision? The work that we did was on 75 years of age and over. So nobody asked you to conduct a study, the type of study I just mentioned, as of, say, 65 years of age, what would the impact be? And you, as a team, a very highly placed one, there to advise elected representatives, you didn't do that. The government made a commitment in the speech from the throne in terms of 75 years of age and more. It was in the mandate letter of the Minister Schultz, and it was on that basis that we did our work. Do you have any statistics? Well, you talked a lot about the distinctions amongst the people who work at age 65. But do you know, I don't have any figures in mind, but I know that there are people who are working at 65 years of age, because if you're just going to be working with your pensions, sometimes you have to go to work. I'm just trying to understand, because in our opinion, it seems quite unique what has happened. When you have a program that starts at a given age, and then I know I only have 2.5 minutes. You're right, Mr. Chair, but how can you seriously justify the change in age? 73. Even 73. I'm not even talking about 65. Moving it from 73 to 75. How can you justify administering a program like that? As I've already said, there were different factors that were taken into consideration for the decision. And ultimately, the government made its decision to have the increase at age 75. Thank you. Madame Chabot.
And with the last round of questions, 2.5 minutes.
Thank you so much, Chair. And going back to my colleague, Madame Chabot, I do have concerns about how this decision was made. I think it'd be helpful to the committee if you shared the actual research and data that was used to decide to withhold any increases to age 75. Just going back, will the proposed long-term care standards include adequate pay, standards for adequate pay for care workers?
The work on the standards is at an early stage, and so I think it's too soon to know exactly what they will cover. The intention of the two groups doing the work is to cover both sort of the built infrastructure as well as the processes and procedures that staff follow in providing care. And so certainly, the things like the what the staff complement is for a certain number of seniors in a home is something that...
Just because I have one other question and I have such limited time, I do think it's a good idea, considering the shortage of staffing, to look at making sure people have a livable wage, to maybe encourage them to take that profession on.
Just one final point, just if I could say that it's very important. The provinces, of course, are ultimately responsible for standards in care homes. So, of course, they will be.
Yes, just one last question. We know the pandemic has been horrific in long-term care homes, and I'm wondering if there's any supports that will be provided to seniors who have survived and have suffered from, for example, and maybe experiencing post-traumatic stress from their experiencing long-term care going forward. Are there any supports that are planned for seniors?
I think that there's a couple of things that come to mind. I mean, certainly the things that we're doing under the New Horizons program and the New Age Well at Home, we'll be looking at supports, perhaps not the dealing with PTSD, but there were some measures in the budget as well under Health Canada's area that deal with mental health supports to Canadians, which of course the government did introduce some measures during the pandemic, and there are other measures in the budget. So certainly would encourage you to perhaps invite Health Canada for discussions on that. Further discussions, as we're not really in a position.
Thank you very much.
Thank you, Ms. Gazan.
Thank you, Chair.
To Ms. Gibbons, Ms. Goulding, and Mr. Conrad, thank you so much for being with us and for your answers to our questions that will undoubtedly be extremely valuable in putting together a report for government. We very much appreciate your service to your country and to government in the professional and patient way that you've carried yourselves today. So thank you so much. I've got one brief question for my colleagues. So to the witnesses, thanks. You're free to go if you wish. And then we're going to adjourn. Colleagues, when we meet on Thursday, we will have Romy Bowers as the only witness. She has asked that she be afforded some flexibility with respect to her opening statement. It presently runs about 8 minutes long. Is there any objection to giving her 8 or 9 minutes for her opening statement? If there is, we'll tell her she's got to cut it down. Any problem with that? Okay. Very well. If that's the case, that concludes the business for today. Do we have consent to it? Ms. Doncho, go ahead.
Thank you, sir. Chair, sorry, I just had a quick question about committee business for Thursday. Yep. It says, were we not supposed to have the rapid housing strategy discussion that day? Or I was surprised to see committee business. I thought we had rapid housing that day. Just can you clarify?
No, I don't recall any agreement to have rapid housing, and we wanted to get Ms. Bowers on as soon as possible, and this was what permitted her schedule. Her schedule only permits 90 minutes, and we do have some things to clear up in the other 30. I can tell you what is on my list.
Sure.
We still need to settle the budget for this particular study. We need to settle the question of honoraria and gifts for witnesses. We need to settle on the amount and the date for the Centennial Flame Research Award. And I think that is it on my list. So those would be the things that will take that first half hour to cover, and then we have an hour and a half with Romy Bowers.
Yeah, the only reason I asked is because we had, when we originally talked about it, we were going to have the sort of the rapid housing update in the same meeting as the Romy Bowers coming. So now we're just, so maybe that wasn't confirmed, but I know that was discussed. So I thought that that's what was happening. But you're saying that that's not the case.
No, that isn't the case. And my understanding is that we were going to have a full meeting with Ms. Bowers, but we could only get an hour and a half. So, no, that isn't consistent with my recollection. But I'm happy to continue this discussion just to see when we can get the rapid housing slotted in. The Bowers thing was kind of time sensitive because under the order in council, we only have until the end of May. Do we have consent to adjourn?
Mr. Chair, I just on that point again, if possible, would it not make more sense just to have those CMHC officials there at the same time on Thursday? That was my recollection to continue after Ms. Bowers' testimony and to provide an update on the RHI. It doesn't have to be here directly, but generally that program goes through CMHC. That's why that was the rationale behind it in our previous committee business discussions.
That actually makes eminent sense. Leave that with me. That makes a ton of sense. That we will arrange for. We'll see if we can secure officials to speak to rapid housing as well as the meeting to deal with her appointment. Yeah, that does make sense. We'll do our best.
Thank you, Mr. Chair.
Is there any other business? Do we have consent to adjourn? And Ms. Doncho, sorry for the confusion. Now that Mr. Viss states it that way, that actually aligns with my recollection. I had a cramp, I guess. Okay. I believe I see consensus, and we are adjourned. We'll see you Thursday. Thank you, colleagues.